Hi, I'm Eugene Sims, physiotherapist and author of How I Achieved Freedom from Arthritis. And I just want to share with you my story about osteoarthritis personally, and then what I've gone on to be able to develop clinically for people who suffer from osteoarthritis. So I was 17 when it started in my knees. I started with the degeneration of osteoarthritis in my knee joints. It was really painful, it was really restricting for me. I'd gone from being completely fit, active, and playing just about every sport I possibly could, to barely being able to run without agony. I couldn't squat. I could only squat to about halfway, and then the pain was just unbearable. I couldn't go further, I couldn't push through it. Even walking up and down stairs was painful. It was really restricting for a young person and very depressing, not to mention frustrating, because I didn't have a way to solve the problem. I had quite a lot of treatment, including physiotherapy. I saw a few doctors, I had surgery, minor surgery though. Nothing helped, and this problem just got worse and worse over the next 7 years of my life. During that time I've been to physio training school, and was kind of resigned to the fact that I would probably be looking at having to replace both of my knee joints by the time I was about 40 or 50. So it wasn't a good looking future for me, and it was pretty grim to say the least. However, it was about 7 years after the problem began, and I was absolutely blessed to find some information that gave me a new approach to dealing with the problem. I took on board that information, and within 3 months I had completely resolved my problem. I had no more pain, I had full movement of the joint, and I had full movement and mobility within myself. I could run again without pain. I could do full squats without any pain whatsoever. My knees were by all means as good as they ever had been. They were fully useful, fully functional and pain-free. I was a very happy man. Over the years working as a physio, have developed that process I went through and developed a system of treatment for osteoarthritis sufferers. Now, this is just so far my word, and you may think, well, this guy could be making up all sorts of stories. Fair enough, and that's why I've taken a few snippets of a few of the clients that I've treated over the last few years, just giving you their story on their improvements and what's happened for them as they've undergone the treatment. So, if you want to just listen on into these next short video clips, decide for yourself. You may think there's something in this, and look, if you do, you're welcome to go to my website and you can receive heaps of free info. I'm just giving away hundreds of dollars worth of information. All you got to do is sign up to receive the free information. So my website is www.freedomfromarthritis.com. You can go there now if you want to, and have a look at what you can get and what you could learn. Or stick around, watch the rest of this video, and you can see what some other people have said about what we're doing. I really appreciate you taking the time to listen, and wish you all the very best in health. Thank you. Eugene Sims.
Okay, from the stretches that I've been advised to go and do at home, I found much more use of my leg, much less pain up in my joint and everything else, more movement, much better life, basically, you know, enjoying it much more.
Great. Better than having it replaced at this stage.
Oh yeah, totally. Now I believe in what you say, that it doesn't need to be replaced. That, you know, basically it's just exercise and stretching, and it's going to be right as rain.
The problem was I couldn't bend my knee. I had a fat knee. The muscles were very, very tight. I had pain going down, and I was not able to stand, being a hairdresser for a long period of time. Coming to see Eugene, it's made a huge difference. I can actually kneel on the floor now. I can also stand all day with my hairdressing career. The knee doesn't swell up and it's not achy anymore. And I find the muscles are just so much easier to manoeuvre, and yeah, it's been great. Yeah.
Okay, so approximately a month ago, 6 weeks ago, my doctor told me that I needed a hip operation. I was struggling to walk most of the time during the day with certain jobs, being a curtain hanger and blind cleaner. My job entailed getting up ladders, which at times was quite a problem, particularly if I had to twist. My hip gave me a lot of problems, and the pain was there for most days. My doctor has suggested that I go get a hip replacement and go through that side. I'm not happy with people cutting me up, so I came to see Eugene Sims. We went through a series of exercises which has freed up my hip quite remarkably over the 6 weeks. I can now climb ladders and twist without any pain. I can just do general running. I can run out of the rain now, which I could never do. and I can jump. I can jump off chairs and such, and like I said, climb up and down ladders. So it's really helped, and I am determined not to have the operation. I'm going to keep doing the exercises, and I know that it's going to work for me.
I went to get an x-ray on my hips because I broke my pelvis in 4 places about 25 years ago, and she said she'd seen better hips on a 90-year-old, and I thought, oh bugger, they're knackered. And so because they were really sore and stiff and getting quite inhibited, I couldn't run and ride white horses. And then after I'd had a treatment here, I was amazed at how it freed them up a lot, and I was greatly relieved because it meant I can, as long as I do my stretches and exercises and get them seen to every so often, I'm a lot more mobile, and I think I won't have to have a hip replacement for 20 more years.
2 years ago I broke a bone in my foot, and took a long time before that was healed. Moved to Warkworth and still had pain in the foot. Went to the doctor. Oh, you don't need to be here, you go to a podiatrist. Went to the podiatrist. He looked at the foot and said, oh, maybe you need some patches under your foot. X-rays I made, and the result came back that they said, oh, it's old age and arthritis. And I thought, I don't believe this. When you break a bone in your foot, something is not right. Then from the x-rays it didn't come any further, and I had to come back for another time, and I came back when I had to bring my shoes. Now I have always expensive shoes, and I have these an inner the leather inner sole, and not only to lift up the middle of your foot but also your forefoot.
Yeah.
And he said, where do you get that? And I thought, who are you that you don't understand this? What is your function? I don't understand, but okay, fine. He said he couldn't do anything for me. That was all okay, and I thought, is that only what you do? Oh, that's fine for me too, but you're not the right one. So that's when I went to Eugene. And I said, that's what's going on. How long ago? I said, 2 years. He said, you should have x-rays afterwards, straight away. I said, I've never had this. What was happening, the big toe was numb, the 2 toes next to it, they were numb. I had no balance anymore, so I couldn't stand on 1 foot anymore when I had no balance. And he'd been working on my foot, and not only on the foot, and gave me exercises, but he said, look, that's where it's coming from. He went up the leg, and he touched a certain point, and it said, ouch! He said, but that's where it's coming from. That's where it is original. And when you don't do anything about it, it goes further and further. And I thought, am I glad that I'm here? So I've been several times doing the exercises, and I'm free. I can grab with my toes the ground again, and I can walk again. So thank you so much.